Yes. Good evening, everyone. Thank you for joining in. I'm Blessing Otoibi, your host for tonight. And joining me is Dr. Annette Akinsete. I hope I got that correct.
Akinsete.
Okay,
Akinsete.
Akinsete. Yes.
It's all right.
Yes. Who has been the CEO and National Director of Sickle Cell Foundation since 2013. Where she continues to propel successful innovative strategies for the prevention, management, care, and support for sickle cell patients with the disorder. So let's just go straight to what we have for today. I know, okay, Sickle Cell Foundation Nigeria is a non-governmental organization for non-profit making dedicated to proper care and control of sickle cell disorder in Nigeria. So I will just maybe ask you, maybe you should give us a little bit of definition what sickle cell is, because most people have different belief or an ideology about sickle cell. So may you just enlighten us briefly.
Thank you for having me. Thank you for the invitation. I'm glad to share information about sickle cell, anything to raise the awareness about sickle cell, anything. And Sickle Cell Foundation is there not just for Nigeria, but for Nigeria and beyond, because Nigeria has the highest burden of sickle cell in the whole world. So it really behoves us. We have to really be in the forefront of this fight against sickle cell, and in fact, all efforts around sickle cell control. So that's the reason we're really there. And sickle cell, like you've pointed out, is a not-for-profit, non-governmental organization. And the reason they stepped up to the plate was that the government of Nigeria was not doing enough. So there was a gap, and it was clear that sickle cell fell through that gap. And so the Sickle Cell Foundation Nigeria stepped up to the plate. And one big thing the foundation has done is to set up or establish the National Sickle Cell Center.
Okay.
And that's the first center of its kind in the whole of Africa. And where everything concerning sickle cell is done, from prevention of sickle cell to treatment of sickle cell to management, care, support, and now even cure. Okay. People will still wonder, people still ask that question: is sickle cell curable? Is sickle cell really curable, or is it a disease that can never be cured? Now, I'm glad to say that we have established a stem cell transplantation center, bone marrow transplant center, and that is the only cure that there is for sickle cell worldwide. Okay? So that said, what is sickle cell? Let's set the stage. What is sickle cell disease? Sickle cell disorder. Sickle cell disorder is really a disorder of the blood.
Okay.
And it is inherited. It is not infectious or contagious. In other words, you can't catch it from someone, from close contact or close association. It's something you get from your father or your mother.
Yep.
And it is the most common inherited blood disorder in the world. So, and that's why people also sometimes wonder, why don't we hear enough about it if it's this common? And well, the reason may be myriad, but I won't even go into that. That's a story for another day. Having said that, I would say we've come a long way decades ago when sickle cell was really considered, like in our traditional society, Abiku.
Yeah.
Abiku Yoruba means born to die. Or if you are from an Igbo speaking part of Nigeria, you call the child an Obanje. Obanje, that is spiritual, something spiritual. So these are myths that we, at every opportunity, we want to debunk. It is not spiritual. It is not Obanje, it is not a Bitcoin, it's a blood disorder. It is inherited. You get it from your father or your mother. You can never get it if your parents don't have that gene. And then we say it is genetic. Even though it's inherited, it is genetic. It is born in your genes. The genes are the tiny things that make you who you are. That give you the color of your hair, the color of your eye, your height, everything, and the way it is on your exterior, so also inside, your physiology. is also genetically determined. The way your body functions is also genetically determined.
Yeah.
The way your blood cells are is also something you inherit from your parents. And that's how we inherit sickle cell. Sickle cell has an interesting story behind it, background story. How did it come about? In medical history, we have it that eons ago, hundreds, thousands of years ago, it was clear that for us, people who live in the tropics, those of us who live in areas where there's malaria, what we call malaria zones. As a matter of fact, if you look at the malaria map of the world and you superimpose the sickle cell map of the world, they are one and the same. So malaria, sickle cell is found wherever you have malaria.
Okay.
So I'm rambling a little, but it's important to address issues that come up like, oh, it's a black man's disease.
Okay.
It's not only black people that have sickle cell.
Okay.
Sickle cell can be also found across West Africa, East Africa, Arabian Peninsula, in the Asian subcontinent, even further east to where we refer to as the Indonesian archipelagos, those islands, and far flung west to Europe, to America. Of course, remember there was slave trade. Slave trade took many people from West Africa to west to the Caribbean islands where there are black people. Of course, it's more common in black people, but not all black people.
Okay.
In Southern Africa, for instance, you don't get sickle cell because the temperature is temperate. The climate is temperate. Northern Africa, you don't get it. It's just across the West African belt. Okay, so I've talked about it that it's a disorder of the blood. Yeah. And it is in the red blood cells.
Okay.
If you remember our biology, is in the red blood cells. That substance called hemoglobin.
Okay, we're going to come back to that. You were when you talked about BMT, that's the bone marrow transplant. I want to ask, what's the success rate of a bone marrow transplant in sickle cell? Because that's like the only cure for it, like you said. So I need to know the success rate of that.
Excellent question. You know, it's what I'll also always emphasize at the outset is that bone marrow transplantation is not meant for everybody with sickle cell. The doctors who perform this procedure are very selective. So they have checked in the boxes that they check off. Once, is a patient having multiple crises every year? You know, those bone pains that prevent them from living well, that reduce the quality of life. You know, is there organ damage? Is there multiple organ damage and so on? So they check the boxes. If the patient is not doing too bad, they will not approve you for bone marrow transplantation because it does have its own challenges and its own complications. Okay, so it's amongst those that are selected. And for instance, in our center, our protocol is only children. Children are easier to deal with in terms of transplant. Children are less likely to reject a graft because this is like organ graft. Okay, whereas an adult is already entrenched in himself or herself, and so is liable to reject what is foreign. So our protocol is children with age between 5 and under 18. That is easier, more success rates. So doctors who do this, very selective, and amongst those that is select, their success rate is up to 98%. 98%. But I tell you, if you spread it across and do bone marrow transplantation for everyone, it would not be that high.
Okay, so
are we having connectivity issues?
No, I think maybe it's the network. So, but now are you saying that adults are not inclusive in the bone marrow transplant, or maybe the significant risk of a bone marrow transplant for adults are quite really high?
Okay, in our center, we stick to the simple protocol, children only. But in other countries, and like our partners in America, Vanderbilt University Medical Center, they do adults, 40-year-olds and so on. The risks, of course, are higher. And again, keeping it simple, we use for only siblings as donors. Only your brother or your sister of the same parents will be your donor because you're closer, you're actually closer to your siblings in your genetic pool than you are to your father and your mother. You're half of your mother and half of your father, 50%, 50%. But you can get 100% match from your brother or your sister. You're closer to them. So we do only siblings. keeping it really simple. In more advanced climes, they may do adult transplants, and they can use father or mother, and those are called haploid or other relatives. That
Okay.
we call that half match.
Okay.
And of course, the rates of success will be less. But again, they have all that it takes to look after those patients post transplant. That is very important.
Okay.
Transplantation, when you go in and infuse the blood cells, it's not so much a problem. The problem or the challenges lie in taking care of the patient post transplantation, because you have wiped out the patient's marrow and open the patient up to infections. So that what usually kills them is infection. If you are able to prevent infection as much as possible and prevent what we call graft versus host disease or rejection of a graft, then the patient will do well.
Okay.
But these complications occur less amongst children.
Okay. Let me ask you this quick question concerning the foundation. Its vision is to elevate the burden of sickle cell disorder in Nigeria and to ensure that all affected persons can live a normal, pain-free life. So what are the procedures and processes a sickle cell patient, known as warrior, have to go through to get access to care in your foundation, in the Sickle Cell Foundation Nigeria?
Okay, at the top of my discussion, I think I prefaced my remarks by saying that we do everything around sickle cell, the entire spectrum, from prevention of sickle cell happening in the first place,
okay,
to treatment for those who already have it, managing them, diagnosing, proper diagnosis, accurate diagnosis, proper management, and up to cure, and then post-transplant or cure management. Okay, in our center, like I said, it's the only center of its kind in all of Africa. In our center, not a hospital, but we're domiciled right across from a teaching hospital. So we collaborate very closely with teaching hospital in the area of research, in the area of treatment, in all forms. And what do we do in form of prevention? Prevention takes the form of genetic counseling, ensuring that people, particularly, and now we're going out to younger people to catch them young, so they know what their genotype is, if they're AS or SS or whatever they are, early in life, before they start dating or getting married or having children, long before. So that's one area, raising awareness, carrying out genetic counseling, carrying out genotype testing in area of prevention. Then treatment. Genetic counseling spans again across the spectrum. Genetic counseling takes place in our center every day of the week, every working day of the week, Monday to Friday, and from 8 o'clock to 5 p.m. And we have excellent counselors. These are genetic counselors, trained, certified genetic counselors that talk to families to have a child with sickle cell. So it's when a child has sickle cell, the entire family is counseled. It's not just the child, because it's a family condition. Everyone has to come on board in taking care of that child. I tell you why. There are children who have become very upset with their parents because they feel that the parents are focusing too much on one child because that child has sickle cell. And that's understandable. But if that child is brought in and counseled as part of the family counseling, everybody chips in and takes care of the one who's not well. That is genetic counseling. Then there's in the area of prevention, prenatal diagnosis. You're able to couples can determine the genotype of their unborn child in early pregnancy. So people ask, to what end are you encouraging abortions in your center? Is that why should they? Okay, so in early pregnancy, first trimester, and the optimal period between 9 weeks and 11 weeks, and it's done by an obstetrician and gynecologist who is certified, and it's just a transabdominal specimen guided by ultrasound. So the doctor sees where the needle is going, and it's picking out what we call the developing placenta. So you don't touch the baby at all. You don't touch the fetus at all, because you don't want any risk of miscarriage or any kind of congenital malformation. So you pick out the developing placenta and the baby are the same, and we test the cells in our laboratory. We have state-of-the-art laboratories that are reference laboratories. The one for DNA laboratory was tailored after King's College Hospital, London.
Okay.
It's just a copy and paste at the same time to suit our own environment and our own local needs. So we do DNA testing for sickle cell, so parents can know before the child is born whether the child has sickle cell. Our reason for doing it in our center is that when a child is born, you can't tell the difference between a child who has sickle cell and a child who does not by looking clinically, and even through the normal testings that we have. You have to do a very special, expensive test to know if a newborn has sickle cell, and that's why we're working with government to start an initiative project called newborn screening, so that every child in Nigeria has the opportunity, has the chance to get tested for sickle cell. Because this is done in Europe, it's done in America, where they have 1/10 or 100 as much sickle cell as we do. They don't have as much sickle cell, but every family knows if a child with sickle cell. So in our center, once the child is born and that child has sickle cell, take them and we begin to treat them preventative immunizations and penicillin antibiotics. And what does this do? This prevents those infections that kill our patients. 150,000 babies are born every year in Nigeria with sickle cell. 150,000 babies, and more than 100,000 of them die before the age of 5. They don't reach that milestone of age 5, and the reason they die is infections. So if we can prevent infections, we save those lives. And this is one of the reasons we talk to them at UN, particularly the Nigerian government. Nigerian government goes to say, this is our report card. There's in the SDGs. This is the area of the Sustainable Development Goals. Goal number 3 speaks to health, and on that goal number 3, there's a target that speaks to children's welfare. Children under 5 want to reduce their death mortality. Under 5 mortality must be reduced, and every country must come and account for the work they're doing to see that. So we're putting to Nigerian government to say that tackling sickle cell is like, for us, low-hanging fruits. For the government of Nigeria, low-hanging fruits.
True.
Once you're able to save over 100,000 babies, and they're going to dent that statistic, because they say we do have a very high statistic of under 5 mortality.
Okay.
So that will help us.
Yeah.
So there's a lot I can talk. I've talked too much already.
Yes, you have. We have a question here.
Support.
Okay, we have one question here. Let me quickly take that. Someone says you should expatiate on the reduced life expectancy in sickle cell disease.
Okay, that's true.
Yes.
This is one of the reasons people really worry about sickle cell. You know that those people who have the condition would say that, look, I would rather die than have a child with somebody with a carrier, or so that I never bring to this world a child with sickle cell. Okay, and in our National Assembly, like a parliament, believe it or not, they're coming up with laws or bills, not yet laws, because we had to kick against it, and we also got the legal association, the law association, to also chime in, because it's also a matter around human rights, that you compel people not to marry. Many churches will not marry a couple if they're carriers, AS and AS.
True.
They will not, and the reason they worry is because they believe that the life expectancy is low. And they're in fact prescription. Some people tell you, oh, your child will not live beyond the age of 16 if child has sickle cell. Some say 25 years. Oh, and with all authority. After 25, forget it, they're dead. And again, that's not true. And if they're properly managed, if they're properly treated, managed, they can live long, productive lives. We have them living up to 60, 70, 80, 90. We had our mama who died at 94, and I don't know how many normal people live up to age of 94.
True.
Okay, so it's not a stroll in the park, mind you. It's not a picnic to live with sickle cell. It takes a lot of care of both the family, the patient, healthcare workers, multidisciplinary care, and all that. But it is possible to help them live normal, productive
Normal.
life if they're properly managed. Especially now, we have better treatment protocol beyond what we used to have in the past. Folic acid and malaria medication. Now we have hydroxyurea. We have Cretumabal. But some have been approved, but I know that hydroxyurea clearly has been approved. What it does is it elevates the blood level, so the patient does not have the anemia that the hallmark of the disease, the shortage of blood. Those are the two key problems in sickle cell: pain and shortage of blood. And all these are caused by that misshapen cell, the sickle of the red blood cell. People also say they're called sicklers because they're always sick. That's also not true, because of the shape of their red cell. You know, and I prefer when I'm meeting people say that red cell is shaped like letter C or shaped like a banana.
Yeah,
I prefer to use that than to say sickle, because I never saw a sickle until I got to end of high school. A sickle is a harvesting tool, look like a question mark. Things you can relate to, like a banana, like a letter C. But those cells don't live long in the body; they break down rapidly. Whereas a normal red blood cell will live for 120 days, 3 months, a sickled red blood cell will live for 10 days or 20 days and break down. So they're always short of blood and weak, complain of weakness. Okay.
I have another question here, quick one. Someone says, how can stigmatization be curbed among medical practitioners against sickle cell patients? Like the people that are supposed to be caring and loving these people are the ones stigmatizing them, maybe when they go to the hospital during crises and stuff like that. So how can it be curbed?
That is so true. That is so true. The only way to curb it is to continue to raise awareness, to continue to educate everyone. Just last week I had an engagement with doctors and nurses and pharmacists, healthcare workers on contemporary management of sickle cell. It involves taking care of entire patients. One sickle cell patient shared with me that she was rushed to the hospital, and the nurse told her, "Hey, by now you should be used to this pain. Come on, bear it. I mean, this is not your first time. You should be accustomed to this kind of pain." That is a no-no. So nurses are constantly being trained. We have to keep updating. The question is, how can it be curbed? The only way it can be curbed is for everyone, all hands on deck, to keep educating, raising awareness, talking to people, healthcare workers, and everyone around. It's not only healthcare workers. Healthcare workers are also culprits, but even families. True. Even families.
Yeah.
Parents will say, "Oh, why? I've wasted all my money on this child."
True.
You know, and then and it's mutual. The child who says, "Why do you bring me to the world?" So there's conflict. There's conflict, and that stigmatization goes beyond. It goes to school. It goes for employment. Sometimes they're rejected in employment. Why? Because they have sickle cell. So this is that thing. Another way to address that is also laws, to put laws in place. The laws that we need for sickle cell are not the kind of laws that are punitive, because that's the sort of thing that we saw our legislators come up with, that any carriers that marry should be jailed for 10 years. That's one punishment. The other punishment prescribed was a fine, a very heavy fine. I don't know how much fine. Yeah. And another one was also, if a child was born to a couple who knowingly went ahead to marry, knowing that they were AS and AS, that child must not be treated in any government hospital. No. That's not the kind of society you want to be. You want to be a kind of society that takes care of its vulnerable people. Okay. But that's coming from a place of concern, but it's misplaced concern. We have to tackle it properly. It's not, and then you don't even, the idea of making sure, like churches, right? We also engage in churches. So it's discriminatory. We say couples must not marry because they are sick, they're both AS and AS. It's a form of discrimination. We have to also educate them in churches. So education must be at all targets, levels, all groups, at all levels. Absolutely.
Yes. I have so many questions here. Let me just take them maybe together, then we'll continue on our conversation. Okay. Ifeoma Williams is saying, Can you please throw more light on the drugs you said is approved and how do we get it? That's one. And he also said the one that works for the shortage of blood. Now, another person is saying sometimes you can get faulty test results and you don't know that maybe the person is a carrier. How do you handle that? Faulty genotype test is adding to the population.
Questions are coming in too rapidly.
Yes.
Let me take them one after the other.
Okay.
The ones about the drugs, newer drugs. Good question. In the past, we depended on folic acid and malaria preventative medication, which we used to call that Sunday. We don't take that anymore. Now it's Proguanil daily anti-malarial to prevent malaria. You know, malaria affects the red blood cells. And the red blood cells are already compromised. So you don't want anything to touch them. So but now hydroxyurea. So if the person can take note of that, or hydroxyurea. I will type it exactly. It's the medication that what it does, it raises I told you that the problem with sickle cell is the red blood cell in a substance called hemoglobin. Hemoglobin is what helps to carry oxygen around the body, without which there's no life. Then the hemoglobin that you have when you're in your mother's womb is designated hemoglobin F. F for fetus. That hemoglobin is just as good and as efficient and as effective as hemoglobin A, the good hemoglobin. You know, the hemoglobin S is a sickle hemoglobin. It's not very good, all right? It's not very efficient. The hemoglobin F is what hydroxyurea elevates. Now, the person now begins to behave like their AS, because there's some sickle cells, some hemoglobin S, but there's also a lot of hemoglobin F. That F hemoglobin behaves like hemoglobin A and is as efficient. So the blood cells carry oxygen around the body effectively, and so the patient has no crisis, little or no crisis, few or no crisis. So that is one big advancement. It took a long time for Nigerian doctors to embrace that medication that called hydroxyurea, but now they're prescribing it readily. It was initially prescribed or developed for cancer treatment. So that's why we met a lot of barriers from doctors to prescribe it. But then the dosage used for sickle cell is very minute compared to dosage. And then the side effects they worry about are like infertility. That's the most important. Infertility. So doctors also work with the patients to say when you're about to have a child, you plan for it and stop that drug 6 months before you start planning to have it. And not because there's evidence, not because there's evidence of congenital malformations, but because they want to be careful on all bases are covered. Because they want to be careful. They wait 6 months before you start having children. There are other minor and complicated side effects like darkening of the fingernails that they complain about as well with hydroxy. The other ones are not yet approved by both NAFDAC or even the FDA, but they are there. A number of other drugs.
Let's go. This person saying,
and while we're there, let's not forget that besides bone marrow transplantation, there's also the gene therapy, which is getting advanced in different parts of the world too. Again, they're still experimental, but it shows that there's hope and there's light at the end of the tunnel.
That's great. This person is saying faulty genotype test is adding to the population of sickle cell in Nigeria. How can that be curbed too? Because you go to a hospital and you want to run your genotype and they tell you you're AA, and maybe you're not AA, you're AS, and you marry someone that is AS. At the end of the day, you produce a child with the excess gene. So that one is not even the person's fault. So
that is really a problem. That is indeed a problem. And we've engaged and we continue to engage with the Federal Ministry of Health for regulation of laboratories. In our lab, for instance, our laboratory is a reference laboratory. That is where everyone if you have a problem anywhere in the world with sickle cell, tests, send their sample to us for clarification, because we have 3 levels of validation before we give a patient a test result. Whereas many laboratories just do the first level, and that first level can have errors. Okay, at the meeting we had last week with many doctors, the question of hemoglobin C came up. There are many people who are AC, like AS. S and C together is also a sickle cell disorder.
Okay.
S and C together, not only SS. Okay. Well, there are many people out there who are AC. They're carriers. They have that C trait.
Yeah.
They're carriers, but they're designated AA. Designated AA for not, I won't say any fault of the laboratory, but maybe ignorance rather than ignorance, because they didn't know that the first level of testing is never enough. You must do another level.
Another test.
And the third, and in a center, we even do a quantification. So you know how much of hemoglobin S you have in your system, not just that is S, but how much of it you have in your system. We have even found out many more hemoglobin types that have not been seen anywhere in the world, but don't cause any disease, that don't cause any mortalities. So those are there. So the only way that can be done is regulation of our laboratories, the medical laboratories, to be sure that they're licensed and that they know what they're doing. And then training. One of the things we're also going to start doing is training not only of doctors and nurses, we want to also start training laboratory technologists and medical laboratory owners, so that they, when they test for sickle cell, they do it correctly.
Okay.
Wrong testing can also lead to divorce. We've seen that happen a lot, because couples say, how on earth can we both be AA and have a child who is SS?
Yes.
That happened.
Okay. Someone is asking, what are the first aid procedures given to someone in crisis? What are the first aid?
Okay, when you say first aid, maybe perhaps I would say, what can you do at home?
At home, yes.
At home before.
How can you
before
manage
you rush to the
cell?
hospital?
Yeah.
Yes, what can you do at home before you rush the patient to the hospital? Okay, like for instance, if it happens at night, sickle cell crisis means emergency, something they have to take quick action. Okay, and usually the crisis in sickle cell is bone pain crisis, pain everywhere, pain that sometimes it relates to they equate to labor pain, or they'll tell you it's worse than labor pain. So it is really severe. So the first thing to do is take medication. But before that, let's dial back. There are many persons who have sickle cell who are very experienced. Or counselors also tell you, understand yourself. This is for older patients, older children and adults. Know yourself, or know thyself. You know, some they study themselves to an extent that they know when the crisis is coming. It may not be pain just yet, but they call it a kind of feeling, a feeling that tells them this thing is coming.
It's coming.
So when it's coming, they take that pain medication early, and that tends to prevent it from escalating to a higher level. Because when the pain becomes so severe, they can't handle it at home. They have to rush to the hospital. And when you rush to the hospital, what do? Usually exchange blood transfusion.
Okay.
Exchange and a lot of hydration. They give them plenty of fluids, because and that's one of the things persons with sickle cell must always do. Drink plenty of water. And young people around this, they have apps on their phones that remind them when to drink water, whether you're thirsty or not. The teaching of the prescribers, you drink lots of water, minimum of 3 liters of water a day. And what the water does is just keeps the blood flowing. Remember that those misshapen red blood cells, what they do is that they block the blood vessels, and so the blood does not go to your organs or tissues. So when you drink lots of water, it allows your blood to flow freely. So what they do is rehydrate you in hospital, plenty of infusion, and then if need be, exchange blood transfusion. They take out a lot of your cells, a lot of your blood, and replace with AA cells. AA cells. And the goal is to reduce those sickle cells to under 30%. By that, by so doing, the patient is yes, even the symptoms improve right there and then, when the patient leaves the hospital.
Okay.
So those are things. So there are do's and don'ts. Do's and don'ts that genetic counselors tend to teach patients with sickle cell.
Yes, I was coming to that, but someone is asking a quick question. What pain medication do you prescribe for a 7 years old?
Okay, I would not normally prescribe on air
Yes,
like this.
because,
No,
yes,
the
yes,
best thing is always to see your doctor and get your prescription. But there are
prescription.
over-the-counter prescriptions that you can take. For children, I can say paracetamol. That's a brand, it's not a brand name. Paracetamol. Over-the-counter analgesics will help when the pain is not yet so bad.
True. Okay.
And then of course there are pediatric formulations in form of syrups, or if you don't get syrups, you can always grind your tablets. But
Okay.
please see your doctor. And if prevention is always better than cure.
True.
Prevention is always better than cure.
Yes,
So you do
true.
see your healthcare worker at least 3 times a year. So if there's any problem, it's nipped in the bud. One other thing that I must put out there before I forget, in case nobody asks, is that children with sickle cell get stroke. They can get stroke.
Wow.
From 8, so all children who have sickle cell between 2 and 16 years must do what we refer to as transcranial Doppler, big name, scanning,
Wow.
ECD scan, and it's a non-invasive procedure. It's just you just touch the temple with a probe, and what the technician is looking for is the flow or velocity of blood in the big blood vessels of the brain. And that tells you which children are at high risk of stroke. I will put them aside and treat them with hydroxyurea or treat them with extreme blood transfusion, and that stroke is prevented. I tell you, prevention of stroke is better than cure. Once a stroke occurs in a child, in any home, that family, the dynamics will change forever.
True.
The dynamics never remain the same. So it's best prevented. So if anybody's listening, please, children, if you know of any family where they have children with sickle cell, those aged between 2 and 16 must see the doctor or nurse or healthcare worker. Just walk into any facility and ask that, please, how do I get TCD done? Because my child has sickle cell disorder.
Thank you so much. Thank you so much for that. Before we go, we're going to take this. What should sickle cell patients avoid? You were almost going there. That's the do's and the don'ts of
yeah.
Very important.
Those are the things that our genetic counselors, they have them written down on their walls everywhere. The do's are plenty of water. I have a favorite 4-year-old, that is 5, who comes to me every so often and says, Mommy, I have look at my umbrella and it's not raining yet. I have my umbrella, I have my raincoat, I have my rain boots, I have my sweater. You say, what is it? You have to, God will say, avoid being in the rain and avoid extremes of temperature. When it's too hot, be sure you cover yourself with an umbrella, because too much heat, too much cold, an air-conditioned room, for instance, can lead to crisis. Anything that causes dehydration, excessive heat will cause dehydration. Okay, so that's number 1. Avoid extreme heat, avoid extreme cold. Take plenty of water. I'm going to mix the do's and don'ts. Make sure that even when you're not thirsty, you drink. Join the young people who have apps on their phones that remind them to drink water. Just keep drinking at a minimum of 3 liters of water in a day. And then avoid sodas. The soft drinks, what we call minerals in Nigeria. Avoid them, because those sodas tend to dehydrate you. Avoid alcohol. Avoid cigarette smoking. Avoid all forms of drugs. Anybody should avoid all of these things, quite frankly, but even more so persons with sickle cell. And then, of course, we talk to women with sickle cell. Every young woman, most young women aspire to be mothers. So also those who have sickle cell want to be mothers. But we also tell them, please do not have more than 2 children, not more than 2 pregnancies, not more than 2, because pregnancy is a big assault to the body. It's quite traumatic to the physiology of the body. To advise them not to. That's going to. I didn't want to forget about pregnant women. And then see your doctor 3 times a year, minimum of 3 times a year. Doctor or nurse or healthcare worker, just be in touch with them. Parents, appreciate your children. Affirm them. Affirm your children. Be positive. And then when we look at the patient with sickle cell, it's not just the physical. We also think of the mental aspect,
Mental.
because they tend to experience a lot of discrimination and stigma. We say, talk to someone if you're worried about anything. Speak to somebody. It doesn't have to be a doctor. It could be your friend. It could be your mom or dad or sister or neighbor. Do talk if you're worried about anything. If you feel sad, if you're feeling depressed, talk to someone. Don't keep things to yourself, because there's a tendency to feel, why must I have this illness that others don't have? Why am I rejected employment when I know I'm as good as everybody else? So there's a tendency to have that feeling of depression or extreme sadness. So do speak to someone if you have all that.
Okay.
So I'm sure there are others that picked, but there are do's and don'ts.
Yes. Very
Take your
interesting
routine
insightful.
medications. Take your routine medications. Everyday folic acid, everyday anti-malarials, proguanil. And then, of course, maybe if you're on hydroxyurea, take your medication routinely.
Okay. There's one question. We're rounding up right now. The person said, what's the most common cause of death in sickle cell disease?
That's a difficult question to answer, because there are many causes.
True.
There are many causes, but because you look at the pathology, right? I call it pathology. You look at the basis of disease in sickle cell. That's that blockage of the blood vessel by those cells. It doesn't allow oxygen to reach the end organs. So there can be multiple organ failure. Name it heart. The heart can fail at any time. Heart attack can occur from blockage of stroke. I've talked about stroke just now. Stroke can occur. Stroke is actually a brain attack. They can have pulmonary hypertension. That is hypertension within the lung system. Okay, they can have pulmonary embolism. That is a clot forming in the lungs and preventing oxygen from getting to the blood. Okay, so, and the other complications that may not be so severe but can lead to death. Infections. You know, I told you infection.
Yes.
And there's a common one called pneumococcal infection that we can easily prevent by immunization and by antibiotics. It can affect the lungs by causing pneumonia, or it can cause meningitis by affecting the coverings of the brain. Those are severe infections that can cause death. Sometimes they have chronic leg ulcers, leg sores that just fail to heal. It's more debilitating than, I would say, a cause of frequent mortality, but it can be infected also and cause infection of the entire blood system and death. Okay, so it's a myriad of problems, but I like always to be positive, to say, let's look after the patients well. Look after them by being prompt diagnosis, prompt treatment, and adequate treatment. Prompt diagnosis, treatment, adequate
diagnosis. Okay, this is the last one. We'll round off with this question. I want you to tell us some myths and facts about sickle cell, because there are a whole lot of myths out there that is not true, that it just beliefs. And
yes, we've touched on a few already during the course of
that you can catch sickle cell. It is not catchable, transferable.
Absolutely. You see, you're already saying everything yourself, you know it. But indeed, it's not transferable. It's not infectious or contagious. It's something you get from your father and mother. It's not a death sentence, as people say.
True.
And that's why persons with sickle cell say they're warriors. I would prefer to call them champions, because they have overcome. And indeed, there's a champions club, that is those who are 40 years and above, have formed themselves an association called champions. Okay, and what about those who say they died by the age of 16? Who prescribed death? Time of death for people. That's a myth. And you see the point that some of my patients have been do not celebrate some Okay,
Yes.
are you there?
Yes, I am.
Are you? Oh, you lost me for a moment.
No. I think something happened with my network, but it's better now.
Okay.
Mm-hmm.
Okay. I'll just saying that. So those are myths. Those, the common ages are 16,
Mm-hmm.
21,
Mm-hmm.
25. It's a lie. Those are myths that they die by those ages. So please, person of sickle cell, celebrate your birthdays. Nobody's prescribing death for anyone.
True.
Anyway, who owns tomorrow, as they say? You can go out on the streets tomorrow and be knocked down by a car. So
Nobody.
it's not, those are myths. The positive thing, which look at it, is this: they can live normal, long, productive lives as long as they're well managed, as long as they're well managed, and they can contribute meaningfully to their communities.
Thank you so much.
I will tell them to pace themselves, mind you. I forget to add pace, because as much as we say we want to be positive, we also know that it's not a picnic. So
True.
please pace yourselves.
Okay.
Then another don't overexert yourself physically. They want to do what everybody else is doing, but please pace yourself. Know your limits. Know your limits and take care of yourself.
You've been so helpful. Thank you so much. Thank you for enlightening us.
Thank you for having me. Thank you.
It's a beautiful one. Thank you. And I hope anytime we call on you.
Any questions?
Yes, we call on you, you're going to oblige us. Thank you. Your organization, foundation, is doing a great job. And we pray that God takes you to a higher level.
Amen. And you too. And then don't forget that you can reach us on all our social media platforms or handles. Twitter, we're on Twitter, Instagram, like this, Facebook, name it, we're there. And we have the website, www.sicklecellfoundation.com.
Thank you so much. Thank you very much. And thank you to everybody that joined us for tonight's section. We say thank you so much and have a beautiful weekend. Don't forget to follow us on all our social media platforms. Visit our website, www.ICIR'Nigeria.org, for investigative reports, media opportunities, so many beautiful opportunities. Thank you so much and have a lovely weekend. Thank you, Dr. Annette.
Thank you.
See you.
Thank you. Thank you too for having me.
Yes,
bye for now.
All right, ma. Take care.